Welcome to the Jeanette Jenkins Show. Today, we are covering a topic that is so important to me as a fitness expert that has worked in this field for over 30 years. Have you heard this before? Is this you? You've been told by trainers over and over, it's only calories in, calories out. So you're counting those calories and you're not getting the results. Well, today I have a board-certified endocrinologist. She is an expert in this field of weight loss and obesity and GLP-1's. Her name is Dr. Rocio Salas Whalen. She is the author of the book Weightless.
How is it going to impact my weight? Am I going to feel guilty? What do I need to do to lose the extra calories that I ate on my plate? When you relieve a person from that, they flourish.
It brings tears to my eyes, literally, because there are so many people who have adopted healthy habits and they're not getting the fat burning results that they're looking for, and they really need to be referred to an endocrinologist.
I titled my book Weightless because it's a metaphor. And I see their journey as they start losing physical weight, right? But then they start losing trauma. They start losing shame.
Oh my goodness.
They start losing guilt.
Yes.
They become lighter. They become weightless.
Thank you for coming through.
Thank you for having me in LA.
First of all, congratulations on the book.
Thank you.
I can't wait to read it. It comes out
December 30th.
December 30th. So before we get started on all the questions that I have for you, I want to know what encouraged you to write this book.
I thought that it was a much needed guide for anybody who's struggling with weight, for anybody who has been invalidated by their doctors, their family, themselves. I wanted a book that had science, but also that it had heart. I wanted a book that people felt seen. And my introduction is a letter of apology to everybody who has struggled with weight, and we were just telling them eat less and exercise more. Yeah. So that's the main reason I wrote the book, but also as obesity science is moving so fast, there's not enough educated or trained or experienced physicians in the matter. So it was a book of my care directly in a book. So it's me holding the hand of somebody who's going through a GLP-1 or struggling with their weight.
Well, as a trainer who has worked in this field for 30 years, thank you. Because I'm sorry, it brings tears to my eyes, literally, because there are so many people who have adopted healthy habits. They're training, they're eating healthy, and they're not getting the fat burning results that they're looking for. And they really need to be referred to an endocrinologist. And so many times I have seen trainers almost beat these type of clients over the head with like, you're too lazy, you're not following what I'm doing, you're not following the rules, you're not getting your workouts in, you're not counting your calories, you're not eating enough protein. And for many of these people, they really do need the help from an expert like yourself.
Yeah.
So thank you. Right off the top, thank you. When we start with just some of the different hormonal challenges that people would have that would stop them from burning fat, can you share some of those?
Yeah, definitely. So obesity medicine has evolved very quickly in the last decades. Now we understand what drives a person to gain weight or have difficulty to lose weight. And I like to break them in 5 causes. Okay. One is genetics. Mm-hmm. So if in your family somebody has history of obesity or difficulty losing weight or easily gaining weight, then most likely you will also struggle with that. Then we go aging. As part, our metabolism slows down as we age. Then we have environmental factors such as the food industry. We live in an industrialized world where we live in cities that don't promote physical activity, right? We're even working from home, being in a car all day. Then we have lifestyle reasons, right? Mm-hmm. Sedentarism and highly processed food. And then we have hormonal causes, right? So in the hormonal reasons, what somebody's going to gain weight because if there's any abnormality or dysfunction in hormones, we have thyroid hormone, right?
Yes.
So hypothyroidism or an underactive thyroid. Thyroid really controls our metabolism. It's like gas for your body. If you have too little hormone, thyroid hormone, you're going to run 40 miles per hour.
Would PCOS and Hashimoto's fall in that category?
PCOS is another hormonal cause, and this is insulin resistance.
Oh,
so in
PCOS
PCOS,
is insulin
yeah.
resistance.
So
Okay.
actually, polycystic ovarian syndrome, the
Yes.
name is very misleading, and that's why many women are not diagnosed. It takes about 5 years for a woman to be diagnosed with PCOS.
Mm-hmm.
Why? Because we're looking for the ovarian cyst or the ovarian follicles.
Oh.
But you can have full-blown PCOS and not even have cysts in your ovaries or follicles in your ovaries. It's more a problem of insulin-resistant hyperinsulinemia and hyperandrogenemia, meaning high testosterone.
Oh, high testosterone.
Insulin resistance promotes hyperinsulinemia. So what is insulin resistant? It means that you're not responding normally to the amount of insulin that you're making. So your body has to make every time more insulin to have the same effect that it had before. That's hyperinsulinemia with insulin resistant. Insulin resistant promotes visceral fat.
Right, around the tummy.
Promotes,
So
yes.
it's going to be hard for you to lose your fat around your stomach.
And visceral fat promotes insulin resistance.
Oh,
and
it's a
insulin
feedback
resistant
loop.
promotes
Oh
visceral
my
fat.
goodness.
So it's a vicious
like
cycle.
Yeah.
It's a vicious, and then we have cortisol, another hormone. That's
High
our stress
cortisol.
hormone. So people that are in chronic stress, people that don't sleep well, right? That their body is in a physical stress.
Like a state of fight or flight.
Exactly.
Yeah.
Cortisol is increases your hunger. Cortisol is a growth hormone, right? So it promotes growth. It's going to promote appetite. That's why some bodybuilders may use steroids, right? Because it promotes growth. But with that, it comes increased hunger.
Yes.
So that hormone also, and then we add in midlife, women in midlife,
All the
where the changes in
perimenopause, menopause.
That also changes the body composition of a woman.
And what about, have you heard of leptin resistance?
Yes, and it's leptin is a very new hormone. It was just discovered in 1994.
Oh, wow.
So it's actually the same time that GLP-1 was isolated from the lizard from the Gila monster. So we have, and actually leptin hormone was investigated as a treatment, but it didn't provide as great results as GLP-1. Reason why we're going to be talking about GLP-1 today and not necessarily leptin resistance treatment. But leptin is a hormone that regulates your metabolism. Also, it controls your appetite. It's produced in the adipose tissue, in the fat tissue. So as insulin resistance, leptin resistant means that your body stops responding normally to the normal amount of leptin. So your body every time has to produce more leptin, and this causes
More
leptin resistance.
Okay.
And this promotes hunger and weight gain.
Got it. So I'm super close to leptin resistance because my older sister has experienced that. And so to see someone firsthand in your family who's exercising, eating healthy, and they're not getting the weight loss results or the fat burning results, that's why I'm so grateful for somebody like yourself to write a book like this and to explain to people that if you're exercising and you're eating healthy and you're not getting the results, then you should definitely see someone like yourself, an endocrinologist. But if you don't have access, then you definitely want to pick up this book so you can read and learn and at least have the knowledge for yourself. So if someone is going through a journey and they feel like, okay, I'm doing everything right and I'm not getting the results, what do you recommend for them to do?
Yeah. So first, to understand that it's not their fault.
Perfect.
Right? If you have a person that is struggling with their weight and they're doing everything that they can possibly do in their control, right?
Yeah.
And they look at their family history, at their mom, at their father, if themselves struggled with weight, or if you look even further, your grandparents, right? If they struggle with weight, then that's almost 50% the reason that you're struggling with weight.
Yeah, my mother struggled with weight, so I'm sure that's how my sister,
we know
genetic.
That the weight of both parents, not just the mother, also the father, the weight preconception or how much they weigh before getting pregnant is going to impact the weight of their child in the future.
Oh, interesting.
Right? We have something that is called transgenerational obesity. So we know that it can go back 3 generations. So if somebody is struggling with weight and they have family history, then they need to know that they didn't cause it on themselves. Even before they were born, they were going to be over predisposed.
Do you hear that, trainers? There's something called transgenerational obesity. So Be kind to your clients. Yeah. And if they're having a difficult time, it's not always just calories in, calories out. Sometimes it is the hormones. You can't solve all of your clients' problems. Please recommend them to go see an endocrinologist.
Yeah. I mean, and it's not just the trainers, it's the doctors, right?
Okay.
So also the doctors, we didn't believe our patients, and I was one of them, right? Before I learned so much from my patients, I have an obesity clinic.
Right.
And before, it was the same recommendation every 6 months: come back, eat less, exercise more. Well, exercise even more. Well, maybe eat even less. How many calories you're eating? Or they would come back and you would say, they're not really following what we're saying. They're not exercising, because if they would have lost weight.
Because
well, surprise, surprise.
Yeah.
Every patient after patient after patient telling me and teaching me about diets that I never heard in my life, for exercise programs. They were doing the legwork.
So what were you doing before GLP-1's then?
Telling them to eat less and exercise more.
Right.
And did we solve anything? No. We just created distrust from patients to physicians.
So how long now have you been diagnosing clients with, or prescribing clients with GLP-1s?
7 years that I started really understanding when a patient tells me that they're doing their work, and to believe them.
Yes.
But prescribing GLP-1, I've been prescribing them since 2009.
So how did GLP-1s work?
Well, GLP-1s, for everybody to know, is a hormone that we make in our gut.
Oh.
Yeah, we make it in our small intestine in response to food in our stomach, basically. This hormone, the problem with our own hormone is that it's broken down within 2 to 4 minutes. And by the way, I want to make a pause here and say that GLP-1 hormone was discovered by a woman.
Hey!
By a female scientist in Rockefeller Center in New York.
What?
She discovered GLP-1 in humans. And this was
when did she discover it?
In 1982, in the early 1980s.
Oh my God, the human body is incredible. There's so much we do not know.
And her name is Svetlana Movsov, and we need to remember her name because female scientists get forgetting in history.
Absolutely.
And
okay, let's say her name one more time.
Svetlana Movsov, Mojsov. Thanks to her, our life will change for the better. For her discovery. Okay, so back to how they work.
Yes.
So the way that they work, and the reason that they were first discovered is because they saw that it had an effect in the pancreas. So when our glucose in our blood goes up from eating after a meal, the pancreas produces insulin.
Yep.
So GLP-1 helps or stimulates the pancreas to make more insulin. So it has a glucose control effect. The beauty of it is that it only works as a diabetic drug if you actually have diabetes. So your sugar needs to be high to act as a diabetes drug. But if your sugar is normal, it's not going to drop your sugar.
Okay.
The other effect that was found later clinically when we were prescribing, and I say because I started prescribing it for diabetes, but when patients were coming back, surprise, surprise, they were also losing weight.
Okay.
And as a diabetes drug that can lower your sugar and lower your weight, we didn't have any. It was almost lower your weight, but they're going to gain weight.
Okay.
We couldn't have the two things in the same
You mean
drug.
lower their insulin, but they were going to gain weight?
Lower their glucose, but they will gain weight.
And gain weight.
Right. So many of diabetes treatment can promote appetite. So patients will lower their sugar, but gain weight.
Got it.
So this was already a breakthrough there, that we had lower glucose and lower weight will translate into also better glucose by the lowering the weight.
Yes.
So off-label, we started using it for weight loss in patients that didn't have diabetes because it doesn't cause hypoglycemia, so it was safe.
Yeah.
Eventually, the clinical studies came and showed that we also have receptors for this hormone in our stomach and in our brain. And in the stomach, the impact that it has is that it increases satiety hormones when you start eating.
Yeah.
So you're going to get fuller with half of what you normally would need to get full. And then it also suppresses the hunger hormones named ghrelin, and it also decreases your hunger in between meals. So for most patients on a GLP-1, it's 2 small meals, feeling content through the day.
Right.
And then in the amygdala, in the hedonistic eating and drinking area of the brain, we have receptors for this hormone. So the reward of food for those that eat for a reward, it's blocked. So when you, let's say for somebody it's a piece of cake at night or a snack, right? It's you at the beginning with this hormone, the behavior is there, so they will reach for it, but they don't have the reward response anymore, so the
Got it.
behavior changes.
So it's that like food noise that people
Exactly.
often talk about so much. Then they're always thinking about food or wanting to eat food or what's their next meal or their next
Exactly.
snack. It helps quiet all that down. That's wonderful. It's so revolutionary.
It is.
I love everything that is happening in this current space, especially seeing these GLP-1s change people's lives. So actually I would love to know from from my personal opinion, to be able to see how it's affected friends and family members and former clients and things that have had this struggle and seeing it change their lives. What have you seen with your patients?
Oh, I mean, it's I am blessed to be part of this time in medicine, because I am seeing the beautiful transformations, and I'm not just going to say physically, of somebody who has struggled with weight, right? What I've learned from my patients, and I have patients from 10 to 80 years old, right? But I would have patients in their 60s and their 70s and their 80s. They started struggling with their weight at 8, at 9, at 10. So you have this person that has decades that their life revolved around the plate in front of them. How is it going to impact my weight? Am I going to feel guilty? What do I need to do to lose the extra calories that I ate on my plate? When you relieve a person from that, they flourish. I title my book Weightless because it's a metaphor. And I see their journey as they start losing physical weight, right? But then they start losing trauma. They start losing shame.
Oh my goodness.
They start losing guilt.
Yes.
They become lighter. They become weightless.
So can you share a story? Like, what was the first story that brought you to tears?
I had a patient, and this is early when I opened my own private clinic in New York, and he was in his mid-50s, and he was coming to me for obesity. And when I explained to him, he was telling me, I'm counting everything that I eat. I have meals delivered. I have a cook that cooks at home. I'm exercising. I'm running. I'm lifting weights, and it's just not happening. And when I explained to him that it was not his fault, and explaining him what are the causes of his weight, he started crying.
Oh.
And this was a grown man. And seeing the transformation and seeing how much lighter and happier, and they're doing things that they were never able to do before.
Absolutely.
And it's just not his story. I mean, I have thousands of stories of patients that their life has improved. Always remembering that this is a medical treatment, right? This is a medication that requires medical supervision. The goal for my patient, and this is another thing that I love of what I do and what I'm seeing, is and the reason that I went into endocrinology was diabetes, because with diabetes you need to get into the patient's head. Okay. And that's very hard to change some behaviors, to make them understand certain things. And with obesity, it's the same, because patients, when they come to me, their first goal is physical weight loss, right? Is to drop pounds in the scale.
Right.
But with tender and gentle and consistent education about what is body composition and what we're looking for and what I want for them, is that they feel strong. Because one thing is how you look, the other thing is how you feel.
Yeah.
So seeing the flip of somebody coming to me and wanting to look a certain way, and halfway their journey is, how did my muscle is? I feel so much stronger. I'm lifting weights. The other day I had a older woman in her 70s, and I've been working with her on gaining muscle, because if you're going to somebody and they're giving you a GLP-1 and they're not talking to you about muscle and protein in your diet, you're with the wrong person. That's a red flag, right?
Okay.
So this woman that I've been working so hard on her to gain muscle, she gained muscle in her core, and she came back to her appointment and she told me, "Doctor, I was going to fall yesterday and I felt my core kept me from falling."
Oh, I love that. I think we need to continue to strengthen this relationship between trainers and the fitness industry and medical professionals like yourself, because I have seen, with my own eyes for sure, so many people who are taking GLP-1s, who are in the gym more now, and you can see that they're doing more, they're going out and they're golfing and they're playing tennis, and it is for many people who have dealt with obesity, it is absolutely freeing, and they don't feel the shame also when they go into a gym as much, or should I say embarrassed of their size, because they don't have the gym intimidation as much. And I just love the stories.
Yeah. And that's something that I want to take the opportunity to say to
Yes.
all personal trainers: don't feel that GLP-1s are a threat to your profession.
Absolutely.
They are not. And what we're going to have, thanks to GLP-1s, we're having such right now, attention in muscle mass.
Yeah,
right. Everybody's talking about muscle mass. Everybody's talking about strength training, which is great. And muscle is medicine, right? Muscle is the organ of longevity. But with GLP-1, you are going to take your clients to where you always wanted to take them.
Yes, I agree.
To being fit, to being strong. Thanks to GLP-1, we are able to get patients to the next level.
Yes, and it really helps you with that patient that you can't get results with. It's like if you're stuck and you've been doing everything right as a trainer, and that client has been eating healthy and exercising, then by all means, like, it's time to reach out to a professional.
And also, when you remove the pressure of weight loss from exercise, it's completely different.
I agree, because this is something that I preach in my profession, and just all the incredible benefits of exercise. And I try consistently to remind people that, okay, I know that you want to work out, because there's the research that backs it, that it's like 70 to 80% of people who are exercising for the physical attributes, right? Aesthetic reasons. But the benefits that you have for lifelong, for brain development, growing more brain cells, hormonal regulation, metabolic function, bone density, cardiovascular, decreasing your risk of cardiovascular disease, boosting your self-confidence, your mental health. Trust, I can go on and on that topic. That's where I live.
Decrease mortality.
Yes.
Decreases all causes of mortality. We don't say that from high body fat. We don't say, we say you're going to develop chronic diseases, but your mortality doesn't increase from having high body fat, but your mortality does increase if you have sarcopenia or low muscle mass. And why? Because talking about hormones, muscle is an endocrine organ. Muscle produces hormones. They're called myokines.
So I'm curious, from your perspective as an endocrinologist, how did you feel when Serena Williams announced that she used what's the trizipatide? What's the one? Zepbound. Yeah. How did you feel as an endocrinologist that someone of her status spoke about it?
What a better proof that we have an elite athlete that has trained all her life, that she has cooks, that somebody's always watching her, that she has won so many tennis championships. I don't know, not medals, championships,
Grand Slams,
US Open, French Open, all of them, right? What a better proof that somebody was actually following to the T what any recommendation that we would give a patient with obesity or struggling with weight still need a GLP-1. Yeah. Why? Because it's not just lifestyle. It's not lifestyle only, right? There's hormonal. She had kids late in her life. She was in midlife. In her family, I don't know her family history, but maybe there is somebody that struggled with weight, right? So there's so many other factors that contribute and take somebody to gain weight and have difficulty to lose weight beyond perfect athletic lifestyle.
Yeah, I, as a trainer, really appreciated the honesty, because I feel like there are people across everything from professional sports to everyday moms to that are either fans of hers or maybe are just happy that she's someone who is helping to remove the shame of, like, if you need additional help in this area, it's okay.
Yeah.
And I think that's so important. So now with all the additional research that's coming out, so I'm starting to hear more about how the GLP-1s are also helping with reducing inflammation, possibly even helping reduce the risk of dementia and cancer and cardiovascular diseases. What's your opinion on all of that?
So it's true. We're seeing all of that happening, right?
Yes.
But I want to remind everyone that those results or those added benefits that we are hearing beyond glucose control, beyond weight loss control, are found in people that started with obesity, the medication, or started with type 2 diabetes, which obesity and type 2 diabetes are chronic inflammatory, puts our body in chronic inflammation, right? And it will lead for somebody to have complications as dementia, cardiovascular disease, joint dysfunction, autoimmune disorders, right? So the results, those added benefits that we're seeing are in people that had already a precipitating factor, right? We don't have any study that says that somebody who does not have obesity, does not have hyperglycemia or type 2 diabetes are going to have these added benefits.
Okay, that's important to know.
So if I hear somebody that says, well, I don't want to lose weight, I don't need to lose weight, I'm going to take it for the other benefits.
Right.
First, I would say to this person, show me your body composition. Show me that you don't actually need to lose weight. And if I see your body composition and you have more skeletal muscle mass than total body fat, if your percentage body fat is below 28 in a woman, below 20 in men, or your visceral fat is low, then let me tell you, you're already getting all the benefits that somebody would get from a GLP-1. But if we look at your body composition and surprise, surprise, your weight, your BMI is normal because your muscle mass is low and your body fat is high, then you will benefit from a GLP-1 because you're going to drop the body weight. And that will give you the extra benefits of anti-inflammatory properties, reducing dementia, reducing cardiovascular disease.
So as a practicing endocrinologist, is there a cutoff? Because you had mentioned 28% body fat. Is that the cutoff for where you would allow a patient to be able to use a GLP-1?
Yeah, so I in
28 is a group, yes.
Yeah, in my practice, I go by body composition to make the criteria of somebody requiring a medication or not.
Yes.
Right? I see so many BMIs 20, 21, 19, and their percentage body fat could be 38. It could be 40. Their visceral fat is high.
Thank you. Can we go over that again? I'm so glad you don't use BMI.
BMI is from the late 1800s.
Yes.
And it was developed for white European male. And it was never developed as a tool for diagnosing anything. It was implemented in the 70s here in worldwide.
By Ansel Keys.
Exactly, by Ansel Keys. So it's a very outdated. Unfortunately, for insurance purposes, to cover these drugs, GLP-1 medications, they base themselves on BMI.
Oh my goodness!
But even the American Medical Association said patients should not.
Insurance companies use BMI,
and they do whatever they want. They do, because normally the guidelines
that is outrageous.
So this is like the official guideline of somebody being prescribed a medication or requiring a prescription is.
Basically what you were saying is that, like, if a woman is 21 on a BMI, but she's 38% body fat, you're looking at someone who's like skinny fat.
Exactly.
Like, they have the body fat, and their body type could be one that's more petite, and so maybe they fit into a size 8 or a size 10, and they don't look like they're obese.
Exactly.
But they have the extra body fat. I know we have to really educate people on body types and genetic makeups.
Yeah. So BMI 27 equal or above with one comorbidity, meaning a complication from obesity or overweight, meets criteria for a GLP-1, or a BMI equal or greater than 30 with or without comorbidities. But some insurances, they would say, I want to see a BMI of 40. So they're following their own agenda, right?
Yes.
But if we eliminate health insurance, which I try to do in my office,
which we do a lot.
Yeah,
it's like if the health insurance companies are going to have to learn, like, you're either going to have to start being for the consumer, or you're going to lose them all.
Exactly. So I recommend based on their percentage body fat, visceral fat. And also, if I have somebody who's trying to lose 10 pounds.
Does the insurance company look at visceral fat?
No. they don't know what visceral fat is.
They don't even know what visceral fat is.
They don't know what would cause visceral fat. They don't know that visceral fat is the reason that we have hundreds of medications for different body systems. They don't. If they would understand that, they will be promoting eliminating visceral fat.
This must be so challenging So then let's discuss telehealth, for example. Like, how do you feel about telehealth?
So,
are you involved with any of them?
No, I am not.
Okay.
I talk about this in my book. I guide patients on how to choose a right telehealth. Unfortunately, there's not enough like me or specialists like me or that they have so much experience and that they go with body composition.
Well, I feel like hello, all you telehealth companies out there, you need to hire an expert like Dr. Salas Whalen, and she needs to oversee your whole program, and then you got something going. So go ahead, tell us what the problem is.
So the problem is that many times there is not, look, when I see a patient for the first time, I spend 1 hour with them.
Yes.
Right? In an hour, I'm going to learn the reason of the gain, the weight gain of the patient.
Yeah.
In an hour, I'm going to determine what's the best course of treatment for the patient. And it's also going to tell me if this patient is going to need it long-term or not.
Right.
You don't get that by filling a form for telehealth, right? You really need to see a provider.
You think if you administer the right questions, like if you were the one who was creating the list of questions,
you can answer whatever you want. It's a huge problem, right?
Okay.
So you can have somebody with an eating disorder and wanting this medication without the proper care. They can be great for eating disorders with the right supervision.
Right.
They are great drugs with the right supervision. But with telehealth companies, just filling a form.
Whereas if you have the client in your office, the patient, you can see if they have an eating disorder visually.
Now, if you have a telehealth company that you're actually seeing a provider, that they're actually talking to you, evaluating you, hearing you, right? Then body compositions are needed on first visit and every visit, right? So if the telehealth company is not offering you, for all my telehealth patients, I send them a body composition home.
Okay.
Because I need to know their numbers. I cannot go blindly, right?
So do you?
So I would recommend somebody
or you go to a place.
You can go to a place that has an InBody, right?
Okay,
and I'm not sponsored by them, or get a DEXA.
Here in LA, I don't know about the rest of the country, but there's several companies that have multiple locations, and you can literally get a DEXA scan for $40.
Oh, there you go.
Yeah.
So then ideally,
it's starting to come really down in price. People are starting to want them more.
Yeah. So ideally, I recommend, and this is all in my book, I recommend in the first visit, prior to using a GLP-1, to do a body composition to know what are going to be the goals, right? Based on percentage body fat, based on visceral fat. And then in every visit, which is every 8 to 12 weeks, we should be doing a body composition, looking what's happening with muscle.
Yes. And when someone hits their goal weight, do they still stay on?
It will depend.
Or it's really goal body composition.
It's body composition, it's history, right?
Okay.
If I have a patient in midlife or after 40 and they've struggled with weight since elementary school, since puberty, since adolescence, then they have a chronic history of obesity or weight gain, then most likely that patient will require to be on it long term. Right.
Okay.
And I take an opportunity to flip to a positive side of long-term use of the medication.
Yeah.
Because for the first time in medicine, we have a medication, a drug that's going to help you maintain the weight loss.
Okay,
because
right.
that's the holy grail,
yo-yoing.
the maintenance of the weight loss, right?
But are there any? Do you see any negative side effects?
No, I mean, we've had the first FDA GLP-1 was in 2005. Prior to that, it was studied for about 8 years. So we have over close to 30 years of data of safety.
Okay.
We know that.
30 years of data is pretty good.
We know, but I can tell you 100% sure what's going to happen if somebody has a percentage body fat of 40 for lifetime, right? Those are true complications. There will be a true disease happening in this patient if it's not treated versus the possible, what can happen in 30 years? That's what I'm not going to use the drug. That's the wrong way of seeing it, right?
Okay.
You are preventing, you are going to drop your risk of disease by dropping the weight.
Yes, and you're going to drop your risk of all these other diseases.
Exactly.
Yeah.
So what we're seeing, I mean, there is a decrease in the incidence of certain type of cancers because there's more than 13 cancers associated with obesity. Breast, colon, prostate, thyroid, pancreatic, stomach cancer. I said in Spanish.
That's okay.
My language is esophageal cancer. So all of them we know that obesity is a major risk factor. So by decreasing obesity, we're going to decrease the risk of this type of cancer, breast cancer, postmenopausal breast cancer. And that is huge.
And so with your patients, you haven't seen any negative side effects from any of them?
None.
That's amazing.
I have not had to stop the drug on any patient.
You haven't had to stop a GLP-1 on any patient. That's outstanding. Because when you're, as someone who's on, social media, you see people that will put out, they cause this, they cause that, they cause this. But of course, I don't hear that coming from doctors.
Yeah. And I'm going to tell you why. And that's the reason that you need the correct medical supervision, because I spend 30 minutes with every patient on their follow-up visit. I can go over everything that they're feeling, happening, questions that they have, and guiding them, right? So I'm always in communication with them to guide them the right way. So that's why I don't see the complications. And it's not that a patient comes and I have only 5 minutes to talk to the patient, then I cannot really make the correct, precise assessment for us individual, right?
I mean, I can honestly say anyone who I personally know who has taken GLP-1s, they have all had nothing but positive experiences.
The other issue is that a lot of people are prescribing compounded GLP-1, right? So all of those side effects that we're seeing in headlines, they're not necessarily from the branded GLP-1 medication, right? In fact, more calls to toxicology or toxic centers
for
overdosing is from compounded GLP-1, right? So using compounded GLP-1, what's compounded GLP-1 is something similar to the brand name medication. When there was a shortage of these drugs, the compounded pharmacies were allowed, certain pharmacies, to make a compounded version of it. But there's no more shortages anymore, right? So we should not be prescribing compounded medication. You should not be buying compounded medication, because who's selling you the compounded medication is not going to be somebody who's an expert on a GLP-1 medication.
True.
To begin with.
I have one just interesting question, because you're still a woman. And so we live in a society that is, I feel, to a degree, is obsessed with thinness. Even though I do agree from a fitness and health perspective that there are legitimately people who need help with GLP-1s and have hormonal dysfunctions, and they need this support. But I also feel that there are women and people who are taking this drug in an abusive way or using it just for thinness.
Yeah. And
how do you feel about that?
I mean, I think that's strongly impregnated in our society, right?
Yeah.
I mean, I have my 11-year-old, and she asked me, "Mommy, do I have a weight problem?" And she's 11, right? And she's
my goodness! And at 11,
yeah, and she goes to an all-girls school. So I'm already starting to, even my 9-year-old, right? So it's something that, as soon as you're conscious, you start to become more conscious and aware, weight becomes part of it as a woman, on how you're valued. What I am seeing, and this is something positive also from GLP-1, and by the way, I'm not paid by any pharmaceutical. It's just that I've seen firsthand what these drugs are doing, right?
Yeah, I feel your passion. You're coming from an educated, experienced, completely different place.
One thing that I'm seeing that GLP-1s is bringing us something positive, besides the many other things that we mentioned already, is a change of the perception of what it looks to be healthy, right?
Yes.
We are now saying strong over skinny, right?
Agreed.
So more women than ever are lifting weights. More women than ever are not afraid of bulking up, because that doesn't happen so easily, right? Unless it's your profession and you're a bodybuilder. That's the only time that you are going to bulk up. But otherwise, it's very difficult to get to that, right? So I feel like there's more acceptance. Like my daughters see me go and lift weights, so they go to me to the gym and like they want to pick up dumbbells. So I do feel that we're changing the idea of what actually looks attractive and is becoming more the strong, the fit, and the lean.
Yes.
Than the skinny.
Yes, and that all the benefits of building muscle, the metabolic health, the brain health, the cardiovascular health. So I do appreciate that 100%. Is there anything that you really want to share more about GLP-1s?
Yeah, I would say to not be afraid of them. I get a lot of messages on my social media that they're saying, "Oh, I know I need it, but I'm scared because of what I'm hearing, what I'm listening." Is to educate yourself, right?
Yes.
Science over fear.
Get her book and educate yourself.
I mean, this book, I say at the end of the book, I say, with this book, my goal is that there's going to be more educated people than actual doctors because of how fast this is happening, right?
Yeah.
And by the way, my book is also for doctors. I got a lot of doctors always saying to me, how can we learn from you? Are you doing any courses? So I made like a good combination in this book that is not a very difficult book to read, but it's also a book for somebody who's starting to practice obesity medicine and prescribing GLP-1 medications to know what I've seen clinically from the last almost decade by treating thousands of patients. Right?
I love this. And it can also be incredible for any family members where you feel like you have someone in your family that's struggling with weight and they feel alone and they're doing everything, because as someone who has been related to someone, when you have family members who are struggling with weight, everyone in the family recognizes that. And so you can also take that step to learn a little bit more, to be supportive to those family members.
So my book is broken into 3 parts.
Yes.
My book is the first part is to understand why you're gaining weight, to understand why you're not losing weight. And if you start thinking of a GLP-1, I tell you how to look for the right doctor, what questions to ask.
I love that.
Part 2 of my book is, okay, you decided to go on a GLP-1 and I give you your GPS, like your navigation system. And your GPS is how to use the GLP-1, protein in your diet. I teach you how to know how much that protein you need to consume to not lose muscle, and strength training. That's your GPS. And then your part 3 of my book, which is one of my favorites, is what happens when you reach your goal.
Yes.
Right? What happens with the physical changes, the emotional changes, the psychological changes, social, cultural changes. So I guide you through that place too.
Do you, in the emotional changes, do you go over how people are treated in the
differently,
in the world?
yes, or even in relationships.
Yes.
So how to go to new social settings, right? What to say, so to get support from others.
Oh, I love that.
So it's another.
You put your
part.
heart into it.
I did, and thank you to my patients that they were my best teachers.
Oh, I love that.
Definitely.
Well, I just love you.
I love you back.
Well, thank you so much for coming to share your incredible knowledge, and I just know it's going to be a New York Times bestseller.
Yeah. And you know that only 6% of U.S. published authors are Hispanic?
Well, we got us a New York Times bestseller. She's Hispanic, so just know you heard it here first.
So support the cause.
We are going to support you. Are you kidding me?
Representation matters.
I hope you enjoyed the conversation. You can get Dr. Salas Whalen's book, Weightless, on weightlessthebook.com. Thank you for watching the Jeanette Jenkins Show. Subscribe on YouTube. Follow on Apple, Spotify, or wherever you get your podcasts.